how the physician-hospital relationship develops is going to be an absolutely critical aspect of where healthcare goes in the future. Physicians and hospitals have typically been very suspect of each other, and as healthcare changes, they're going to have to be a seamless delivery environment. They have to develop the trust with each other. We have to help the physicians understand how the hospitals are providing their care. Hospitals have to understand how the physicians provide their care, and we have to develop that bridge between the two, because that's where the quality will be delivered, how that new model will be put together to deliver that quality. It is going to require the seamless cooperation of the hospital and the physician in order to deliver effective and cost-effective health care.
Some of the ways that the relationship between hospitals and their physicians will change and are changing around the country are in a couple of key areas. First of all, the relationship itself. As hospitals employ more physicians who have up to now been independent, the hospitals and the physicians have to adapt to new leadership, new organizational structures, in some ways new compensation plans, and new operating structures, policies.
People tend to view physicians as being different, but they're not. They're people. And they have aspirations and frustrations, and just like you do. And we in the healthcare profession tend to treat them as being something different because they have physician in front of the name, but they're not. And so it's easy to make them frustrated because they have a very difficult job. They typically want to just take care of their patient. They're not really interested in all of the administrative things that we put in front of them. And so just keep that in mind. I think that there are 3 or 4 critical mistakes that most health systems make in dealing with their physicians. And these are critical as the health systems get back into the physician business. The first one would be communications, and clearly setting the expectations for the doctors, and then communicating to them what to expect, and lay out a very detailed work plan so that they know what you're going to do, what they're expected to do, what's going to happen in the first 30, 60, 90 days. Second thing that I would characterize as a mistake would be where the hospital wants to treat the physician as an employee. You need to treat them and act as if they are equals to get a partnership with the health system. I would think a third thing that is very critical but is always a mistake, almost every single time. The hospitals will underestimate the complexity of running a practice and running a group of physicians. And because they underestimate that, they won't resource it properly. And so when you come out of the box and you're not resourced properly, again, it creates a lot of frustration. And then I would say a fourth problem or hindrance of getting in the physician business would be typically there's history, there's baggage, through the years between the health system and the physician. Well, get over it. We're going to create something very new, very good, very healthy. It's going to be good for you, doctor. And you will like it and you will be successful. And we have to put the past aside. And so we want to move forward. Another problem that hospitals ignore, just because the hospital has a culture, you expect moving doctors into your system, they are going to adopt your culture. It doesn't happen that way, and you have to work at it, and you have to constantly motivate these doctors to believe in what it is you're trying to create.
The doctors and hospitals have always needed each other and always somewhat resented each other. They now more than ever are being pushed together to try to figure out how they're going to work together to make this healthcare delivery system better. And the hospitals need the doctors, but they don't really like fooling with them. And the doctors really need the hospitals, but they don't really want to work with hospital administration. Now, more than ever, the trend says, figure it out, hospital and doctor. Give me something that's integrated, give me something that's seamless, give me something that's high quality, that's patient friendly, and that's a change, that's a trend, and the world is changing for those who run physician practices and for the doctors that are in those practices.